well-being of Scrappy turnaround, the medical professionals lastly give hope. In the first chapter, the struggle starts. On a Sunday morning that was otherwise peaceful, the first indications of trouble began to appear. Scrappy, a golden retriever that was full of life and energy, was the one who would typically be the first to greet the family each morning with a bark and a tail wag that was full of enthusiasm. Scrappy had a way of filling every room with warmth and life wherever he went, whether he was chasing a ball in the yard or curling up beside the fireplace. His enthusiasm was unparalleled. On that particular day, however, things were different. Even though he was generally overflowing with enthusiasm, Scrappy was lying on his bed and stared at the door. The twinkle that normally appears in his eyes was absent, and his tail, which would normally wag in response to even the slightest sound, remained motionless. During this time, the Miller family's hearts started to become filled with concern. "It's possible that he's just exhausted," Sarah, Scrappy's owner, remarked, hoping that it was nothing more than a simple case of overexertion from the trek they had done over the weekend. On the other hand, she had a gut feeling that something was wrong. The severity of Scrappy's symptoms increased as the days went by. His appetite had diminished, and he appeared to be lethargic. Even the sweets that he enjoyed the most were of little interest to him. The once jovial dog who looked forward to playing with his ball had deteriorated into a pale imitation of his former self. Both Sarah and Jake, her husband, were increasingly concerned as time went on. They had always been very concerned about Scrappy's health, taking him to the veterinarian for inspections on a regular basis and ensuring that he received the finest possible nutrition and exercise. However, this was no ordinary situation. Chapter 2: The Visit to the Veterinarian. After seeing Scrappy's deterioration for a few days, Sarah ultimately came to the conclusion that it was time to take him to the veterinarian. The trip to the clinic of Dr. Simmons seemed to take an exceptionally lengthy time. Scrappy's occasional whimper was the only thing that disturbed the silence in the car, and Sarah's heart fell at every noise that broke the silence. Do you know what was going on with their dog? He wasn't getting better, so why was that? Scrappy had been under Dr. Simmons' care ever since he was a little puppy. He was an experienced veterinarian. Her demeanor had always been one of composure, reassurance, and painstaking scrutiny. Upon Sarah's arrival, she quickly became aware of the concerned expression that was there in the doctor's eyes. "Let's take a look at him, shall we?" As she made a gesture toward the examining table, Dr. Simmons addressed the patient. Scrappy was carefully lifted onto the table, and his legs shook as he was raised. As Dr. Simmons examined his coat, listened to his heart and lungs, and checked his vital signs, he appeared to pay little attention to what was going on around him. The expression on her face, which was a move that caused Sarah's stomach to turn, appeared almost immediately. In a low voice, Dr. Simmons expressed his concern that Scrappy was exhibiting symptoms that indicated a more serious condition. "It will be necessary for us to do certain testing, but I have a strong suspicion that it is a degenerative condition. It is possible that the condition is an autoimmune disorder or something similar to canine lymphoma." "It is lymphoma." Sarah experienced a buildup of a lump in her throat. She was familiar with the word, but she had never considered the possibility that it could be applied to her cherished puppy. A series of diagnostic procedures such as blood testing, X-rays, and a biopsy were recommended by the veterinarian. In a frantic attempt to get to the bottom of the matter, the Millers agreed. Diagnosis is covered in Chapter 3. For the next 48 hours, it seemed like an eternity had passed. As the Millers sat in the waiting room, their hands were tightly clutched together as they waited, anticipating the findings with a great deal of excitement. An air of solemnity appeared on Dr. Simmons' face as he emerged from behind the curtain. She started by saying, "I have the results," as she sat down across from them. "It has been established beyond a reasonable doubt that Scrappy has been diagnosed with autoimmune hemolytic anemia, also known. This indicates that his immune system is fighting his own red blood cells in an incorrect manner. Even though it is a serious ailment, it is treatable if the appropriate care is provided. Sarah's chest was filled with relief, yet it was tinged with terror at the same time. Although it was not cancer, it was still a significant risk to Scrappy's health due to its presence. There was no assurance that the treatment would be successful, despite the fact that it was a condition that required quick and intensive care. "How do we treat it?" Jake inquired with a strained pronunciation. "We will begin by administering drugs to suppress his immune system in order to prevent it from attacking the red blood cells. Additionally, in order to maintain a healthy red blood cell count, he will require regular blood transfusions. However, during the next few weeks, we will need to keep a tight eye on him to observe how he reacts to the situation." The news that Sarah and Jake received was not what they had hoped for, but it was a diagnosis and a clearly defined road forward. Plus, for the first time in what seemed like days, they experienced a glimpse of hope. At the beginning of the treatment, Chapter 4. A comprehensive therapy plan was developed for Scrappy. In an effort to forestall the development of secondary infections, he was prescribed a course of immunosuppressive medication, steroids, and antibiotics. They were instructed to administer the medications to him at home, which was a chore that they took on with a strong sense of commitment. Additionally, they went to the veterinarian on a regular basis for blood transfusions, and it seemed as though each time Scrappy received a fresh batch of healthy red blood cells, it gave him a surge of vitality. Under these circumstances, the Miller family came together in support of their dog. Jake made adjustments to his schedule in order to guarantee that Scrappy would never be left alone, and Sarah took a leave of absence from her job. They maintained a careful check on him, closely monitoring his symptoms and ensuring that he was eating, drinking, and receiving sufficient rest at all times. They sat next to him for a considerable amount of time, conversing with him, patting him, and ensuring that he was aware of who he was loved. We rejoiced over even the smallest indications of development. The strength that Scrappy had lost started to come back to him. He appeared to be more interested in his surroundings, as evidenced by the fact that his tail waggled in a hesitant manner here and there. Although it was a gradual process, his hunger eventually returned, and he was soon ready to resume going for short walks. Although Scrappy was not the same invigorating individual that he had been in the past, he was making progress in his life. The obstacles, which is Chapter 5. All things considered, the road to recovery was not an easy one. The condition of Scrappy was erratic, and there were times when it appeared as though he was getting better, only for his symptoms to become even more severe again. His red blood cell count would go up 1 week, and then the following week, it would plummet to a level that was quite dangerous. The Millers found themselves returning to the veterinarian on a regular basis, and each time they did so, they did it with their hearts in their throats. On a night that was particularly challenging, Scrappy once again got listless and was unable to lift his head above his shoulders. Both his gums and his breaths had become pale, and his respiration was shallow. Fearing that they were about to lose him, Sarah and Jake hurried him to the clinic as quickly as they could. In a hurry, Dr. Simmons took their action. A second transfusion was given to him, and she also made some adjustments to his medication. Her tone was soft as she said, "This is a rough patch. Do not, however, give up hope. Scrappy is a fighter in his own right. We are going to make it through this." That is exactly what they did. The link that existed between Scrappy and the Millers was only strengthened by each setback, despite the fact that it was devastating. They did not give up on him, and Scrappy, in turn, continued to fight against them. The 6th chapter. A Beginner's Mind. There was a surprising change that started to take place after several weeks of intensive treatment. The blood cell count of Scrappy returned to normal. Increasingly, he was able to regain his strength. The veterinarian had a cautiously positive outlook. The warning that Dr. Simmons sent was as follows: "We are not yet out of the woods, but Scrappy is exhibiting symptoms of recovery that we did not anticipate occurring so rapidly. They were ecstatic about everything. On the road to recovery, Scrappy was not even close to being the same person he had been in the past. He began to take longer walks, his hunger grew more robust, and his tail began to wag with an increasing amount of excitement. They continued to experience difficult days, and the future remained unknown, but the optimism that they had clung to was at last beginning to materialize into reality. When Sarah opened the door on a chilly fall morning, she discovered Scrappy waiting for her at the bottom of the stairs. This was the moment that marked the genuine turning point in her life relationship. It was brilliant in the sunlight, his eyes were sparkling, and his tail was wagging briskly. His coat shone brightly. Scrappy was experiencing genuine happiness for the first time in what seemed like months. Chapter 7. Completing the last exam. As time went on, Scrappy continued to make progress in his development. Despite the fact that they were aware that his recuperation would be a lengthy process, the Millers were under the impression that they would be able to control his condition. As time went on, the regular visits to the veterinarian grew less frequent, and gradually the fear of the unknown began to go away. They were relieved to hear the excellent news that Dr. Simmons had been waiting for when he performed his final checkup. A grin appeared on her face as she stated, "I am pleased to report that Scrappy's blood tests have now returned to completely normal levels. He is now considered to be in remission." Sarah's eyes began to well up with tears as she cuddled Scrappy, who was wagging his tail in an extremely enthusiastic manner. "Yes, you did it, my friend." "They were successful," she murmured. Despite the fact that it had been a long journey, filled with apprehension and uncertainty, it had also been a journey filled with love, hope, and resilience. The reversal in Scrappy's health demonstrated that even in the most difficult of circumstances, there is likely to be a glimmer of hope at the end of the tunnel. Furthermore, as Scrappy leaped about the yard that day, his energy rekindled. It became abundantly evident that the much-loved dog of the Millers had returned, and he was more powerful than ever before. The conclusion: a promising future. The tale of Scrappy's miraculous recovery from his illness became a powerful illustration of the transformative potential of hope, tenacity, and medical knowledge. The Millers' friends and family, as well as everyone else who heard the story, were motivated to persevere in the face of adversity, regardless of the circumstances. As for Scrappy, he continued to spend his days basking in the sun, chasing balls, playing with the children, and reminding everyone he came in contact with that life was about more than simply surviving. It was about thriving. Additionally, for the Millers, each and every wag of Scrappy's tail, each and every joyful yelp, and each and every loving nuzzle served as a reminder of the strength of their bond and the remarkable adventure that they had collectively experienced.